Welcome back to our Global Health and Wellbeing Coaching Symposium. I'm Eugene Borohovich. I'm the co-founder and CEO of YourCoach Health. And this fireside chat is all about digital health and coaching and how health and wellness coaches are instrumental for clients, members, and talents. And joining me here today is Patrick Burke, Head of Healthcare at Twill. Patrick, welcome. I gave you one-liner, Head of Healthcare, which is, I guess 3 or 4 words, depending how you spell healthcare, but there's much more to Patrick than that one line. So maybe introduce yourself a bit more.
Well, thanks for having me, Eugene. It's always a great partnership with you. So what I do at Twill is I think about it as the end-to-end client experience. So I'm accountable for all of our clients across our globe, health plans, global employers, and our life sciences and pharma clients. So that's it's my exciting honor, and it's one of the funnest parts of working alongside your team here there at YourCoach.
Awesome. Yeah, and I think obviously we're talking about with Twill, and Twill is while as I know it was always there from the beginning from a company formation, but you guys have transformed. So maybe tell a little bit to our listeners and viewers, what is Twill all about?
Well, and you've been along for the journey. And like you said, Eugene, we've talked a lot about together how siloed and fragmented the healthcare system is. That's why you set out to do what you do. And that's why we've set out for the past decade here at Twill to make a difference. Ultimately, that fragmented healthcare system is where we're both leaning in. That traditional model is highly siloed. And in our view, digital solutions have been plenty. They've hit the market. And in many ways, they've amplified those silos rather than maybe simplifying them. So what we are, at Twill, rather than being left with this increasingly fragmented system, we believed in an approach that's centered around the needs and preferences of the user, just like you. And so when we look at what Twill does in short, we exist to untangle that complexity of that fragmented care system. What does that all mean? What's the
I
TLDR?
was gonna try to get you peel the onion a bit more for
when you think about what Twill does at our essence is we're orchestrating and delivering a simpler and I would say comprehensive digital first care for every person that our clients allow us the honor of serving, right? So it has a couple things that we weave together: mind and body, the comorbidity of mental health and physical well-being. But it's also about weaving together the things that are, in essence, today, this proliferation of point solutions. Because at Twill, we don't make point solutions. We make what we call a sequence. And these sequences are unique to each client. And what does that mean? It's our digital first solution, right? That's providing that care I just mentioned, but it's really targeted at certain health conditions, from mental health, pregnancy, women in midlife. Think about MS, psoriasis. What's the tie-in there? It's context. How can someone physically get better and also attend to their mental health needs? So our solution, what we do and what we build together is to take the elements of our therapeutics. So we have engaging communities, we have digital therapeutics, and then we combine them with like the YourCoach Health's human coaching, with telebehavioral health, with our AI, and we envelop that all together. And like we're collaborating on is then we can also extend that to our clients' ecosystem. So that sequence moniker, I know maybe it's a very different name, but it's like a DNA sequence. How unique is our clients' needs, and how can we bring together in an open way a solution that's going to be supporting their members?
It's funny, I've actually never heard you guys talk about, kind of a DNA sequence or the word DNA. But if you think about, right, all human beings, there's just a small little gene that can be turned on or off, right? And this is where a lot of our differences come in. And so while the experience needs to stay consistent and user-friendly, it is highly personalized at the other end, right? And I think this is where, our industry is healthcare. To me, this is very much of a conundrum now. We want to do population health management, but an N=1 level. And to me, sequences allow that, right?
They do. And in many ways, all the clients we're serving together, Eugene, they've invested heavily, and rightly so, and solving problems. So having the ability to work with partners in an open way that kind of weave together what they need is kind of what the exciting part of, I think, what we think is ahead in healthcare.
Let's talk about so the live component of health coaching that we're powering up with you guys is called Duet, which actually I haven't really thought about. We just kind of took it as is. But here your coach would say, for the foreseeable future, the human eye is still better than AI. It's AI is there, the technology is there for self-paced things, but it's actually that combination of advances in technology. Plus, as our logo is a hito, the Japanese symbol for a person, you always need a person to lean on. And so maybe take us back on your guys' initial thinking about health coaching in this duet, right? So duet, technology plus humans.
Yeah. No, even before the pandemic, we've all seen the need that existed. It's why the entry into digital health has been so exciting, right? So many entrants. But what has not gone away, and we've seen it again before anything that hit with COVID and the global pandemic, was that need to blend digital and human. That need is not going to go away. The proportion of human and digital, I think, is what we're seeing is like, what's that ratio? So that challenge is, I think, in many ways, how we uniquely unify what we're doing together for exponential value. Because by serving a broad range of companies and clients across industries, I think what we find is that if you're a global employer, you might be looking at very diverse and challenging to reach employees around the world, or a health plan who's trying to reach people who are in a healthcare desert, or a patient support program for a pharma client. The point is finding a partner to Twill, like YourCoach Health, who can look across that diverse book of companies who have very common needs but deployed differently, was one of the critical reasons we looked for someone who had that breadth, who aligned on the blend. There are a lot of coaching companies out there, and there are a lot of digital first companies out there, but who share the same interest and commitment to the blend, I think, in my view, is why it's exciting in the work we're doing together to deliver value for our clients.
Yeah, we're in the same DNA, right? So very much so. Yeah, you alluded to self-insured employers or large employers, health plans. You even mentioned life sciences companies, and maybe for our audience, let's break this down let's start with kind of self-insured employers. The ones that are watching the space. Employers are bombarded, right? The proliferation of individual tools, right, for very specific reasons have been just growing, right? It's a swarm, and everything that I've seen, employers are no longer looking for new solutions. They're looking to kind of expand the breadth of that. But what do you hear in the market, and why? Again, that combination, because the clinical spend of large employers is huge and growing. And access to care, right, in a self-paced way is there, and that's what proliferating that access to care. What are you hearing about coaching from the employers? And then we'll move on to the next.
Well, I think it goes back to one of the things we were talking about at the beginning, is that the introduction of the coaching like point solution and a self-care point solution and a chronic care point solution has been useful to them, right, if I'm a self-insured employer. And what they're finding is the common issues are in getting people engaged. How many different places does someone have to go? And when it comes to coaching and consistency matter. So like in the work that they're looking for to kind of knit things together, but to really have coaching that can be deployed in any geography, to any demographic, from a white collar accounting team to say a delivery center or a manufacturing floor. What they want is to know that they're being coached to the things that are needed by the individual, but to a consistent model, right? And what we're doing together in many ways is addressing that, because everyone's life needs are different, and life coaching or health coaching is unique to each individual each and every time. But what's the consistency? Getting them to interact with clinically effective activities that are clinically shown to actually address the mental health and physical well-being of people. So that's, I think, how the employers are thinking about it. And that need is really dialing in now, because they're just looking for integration and consistency.
Yeah, and we also, just to maybe add a little bit, again, I think as our healthcare system and the spend continues to grow, right? That and I think what COVID has showed us and continues showing us that yes, it's self-care, which again, this is where a lot of the science-backed, self-paced tools, therapies come in, and getting an appointment with a doctor, finding the right one, right? And so it's just still challenging. And what we've seen in the front lines from a coaching, people are hurting, they're lost, they don't know what to do, right? And I think this is why we value what we do together now every single day, because it really showing people that, again, tech is there, will always be there. Surrounding that with a human that's empathetic is great. And maybe you don't even need to navigate into the healthcare system, right? And again, coaching, just to be clear for everyone, it's a non-clinical service. It's not there to replace the
Yeah.
doctors or clinical staff. But um, yeah, I mean, we can probably keep going and patting ourselves on the back, and I don't mean us as two companies, right, or two people, but just the combination of all these tools. I think while self-insured employers have growing needs, health plans, especially the larger ones, have different needs, right? And there's they're also selling to large employers, they're selling to governments, et cetera. Maybe again, what are you hearing there? As far as the need of the tech plus human.
Well, I think there is a consistency to what that self-insured employer, and again, they very much relate to one another. Self-insured employers
Yeah.
are served by the health plans.
Yes.
So that consistency in care, I think a lot of it is amplified in what you were just mentioning, which is what's happening in the meantime. So they may not need a higher acuity intervention into the health plan, into a network, for example. But what's happening, and can they get the support with a blend of human and digital? That is important to our health plan clients. They are investing in looking in the lower acuity preventative
Mm-hmm.
and other ways to, and they're having big like integration issues because it's all fragmented. So what we just talked about that marriage of what can members do in the meantime, either before they get that appointment, if they can have a blend of self-care that they can do 24/7 and also access to a coach
Mm-hmm.
that's going to help them. That we're hearing more and more is highly attractive to the health plans.
And then let's touch a little bit on, biopharma or life sciences, pharma, whatever the names are these days, right? But ultimately, it's the biologic side of our bodies, right? I know, again, I'll kind of kick it off, but I'm curious what else you're hearing. It's everything from health coaching as this non-clinical psychotherapy. Think about a patient going through a clinical trial. All right. Think about a patient that was just put on a drug, new to therapy, around a patient support program. So again, would love to hear kind of what you guys are hearing in the marketplace a bit more.
Yeah, well, adherence is one of the main things that they're all challenged with. Because why? Because as you and I, as patients, we're busy in our lives, and our mindset matters of how we adhere to what we're asked to do by our physicians. Right? That's just been age old forever. But I think the what we're hearing more, I think, relevantly with coaching and where it fits in with digital self-care is in these patient support programs. Right. And also, but in service of what's important, right, which is adherence and better outcomes.
Yeah, it's interesting because and I've been using this kind of as an example. No patient, and I think the ones that listen to my DTX podcast, so shameless plug in our own symposium for another piece of media that we put out. I always talk about how much I hate the word adherence, but yet nobody wants to hear that you're not adherent, right? And patients and individuals want that autonomy, and so we kind of look at a health coach, that's somebody who can help them find that autonomy. And instead of saying you need to take this medication and adherence, it's really around understanding what those goals are. It could be as simple as being able to get up from a chair and play with their grandkid, right? And then that adherence is now part of it, right?
Yeah, I mean, you hit on it, Eugene. I mean, like adherence can be just how many times do I need to take my meds, but the adherence to the lifestyle changes, the adherence to the things that coincide with that care. Are they hydrating? Are they sleeping? Are they walking? The things that are this nice blend between human coaching and digital self-care that reinforce behavior change, which is what this is all really about.
Yeah. Well, and as we're sort of coming towards the end of this session, we always try to look kind of what happened in the past, right? What's happening now, but also, how do we see the future playing out in this, let's call it tech plus human relations it's not going anywhere, right? That's the reality of today. Where do
That's
you see it?
Well, I think what's exciting is we'll look at the amount of literature that's for coaching standalone or digital therapeutics and self-care standalone or peer-to-peer support standalone, or think about the exciting field that we're in right now and looking at measuring the impact that the combination of things, and it's just a more modern way to think about it, isn't it, Eugene? Because like I'm in my late 50s, but I'm on social platforms. I'm bombarded, and the way I need to take care of what I need to be doing in my life is multi-channel, and so it's a really exciting moment for us all to say, okay, how do these things have an exponential, how the combined and an exponential impact? Because a lot of times in healthcare, we're trying to discreetly look at one thing and one outcome. And I think we have a great future ahead to kind of be looking at these things in combination and seeing what kind of impact we're going to make.
Yeah, yeah. I'm just gonna add one little thing to this. I mean, you mentioned kind of standalone studies, et cetera. I mean, we're finally publishing that report, and so the folks that as you're watching it, you can still sign up and to download yours when the copy is available. But a little bit of the preview there is that we've seen, we've counted almost 500 studies with health coaching in the last 20 years, and majority of those have been done in the last 7. So that, again, that need for that human touch, because we all know there's just not enough doctors, not enough nurses out there. And so that's a little bit of a preview. And so with that, Patrick, thank you so much for making the time. And to the audience, hit in as you're watching in the chat to download or sign up for the report, and stay tuned for the next session.
Thanks for having me, Eugene. It was great.